If your back hurts, your first instinct is probably the same as most people I see. I need an MRI. It sounds logical. If something hurts, you want to see what's wrong. But what if I told you that getting an MRI too early can sometimes make it harder, not easier, to find the right treatment? In some cases, it can even lead to unnecessary worry and treatments you may not actually need. So how do you know if you really need an MRI? The answer surprises a lot of people. One of the biggest misconceptions about back pain is that the more pain you have, the more likely something serious is wrong. But that's not always true. I've treated patients with severe back pain whose MRIs looked relatively normal, and I've seen people with multiple bulging discs with little to no pain at all. How is that even possible? It's because an MRI shows us what your spine looks like. It doesn't always tell us what's actually causing your pain. That may be the most important thing to understand about MRI scans. Here's another fact that surprises almost every patient I talk to. Research has shown time and time again that many healthy adults with absolutely no back pain still have bulging discs, arthritis, or degenerative changes on your MRI. In other words, just because an MRI finds something doesn't necessarily mean that that's what's causing your symptoms. That's why we don't treat your MRI images. We treat you as a patient. Before ordering an MRI, we want to understand the full clinical picture. When did your pain start? Where does it hurt? Does it travel down your leg? Is there numbness, tingling, or weakness? Has it been getting better or worse? Those answers are often much more valuable than the MRI itself. The good news is that most episodes of back pain improve with time, movement, and conservative care. Muscle strains, irritated joints, and inflammation often begin improving within a few weeks without any advanced imaging. So when is an MRI actually the right choice? If your pain has lasted more than 6 weeks despite treatment, if it's shooting down your leg, causing numbness, tingling, weakness, or making it difficult to walk, an MRI can help determine whether a nerve is being compressed and guide the next step in your treatment. There are also situations where you shouldn't wait. If you've had a significant injury, a history of cancer, unexplained weight loss, fever, signs of infection, or you've lost control of bowel and bladder function, those are medical red flags that require immediate evaluations. In those situations, imaging is extremely important. So what's the takeaway here? An MRI is an incredibly valuable tool, but only when used at the right time. The goal isn't to get an MRI as quickly as possible. The goal is to understand why your back hurts first. Sometimes an MRI is exactly what's needed, and other times it's not. The best treatment decisions come from putting everything together: your symptoms, your physical exam, and when appropriate, your imaging, not relying on the MRI alone. If you're wondering whether an MRI is the right next step for your back pain, start with an evaluation. Once we understand what's causing your symptoms, we can decide whether imaging will actually help move toward the right treatment. I'm Dr. Sam Peña, chiropractor here in San Antonio, Texas. And if you found this video helpful, be sure to subscribe for more honest spine and back pain education. My goal is to help you understand your spine so you can make informed decisions and get back to living with less pain. Thanks for watching. I'll catch you guys in the next video.